This is the Begin Within podcast, where we believe real, lasting health and fitness requires you to start inside before you work out. I'm your host, Nate Slegger, and I'm here to show you behind the scenes of fitness. You already know exercise is good for you, but what about all the other things in life that affect your fitness? If you're looking for extra motivation to get started or to make sure you keep going, this is the place for you.
Produced by BeginWithin.fit.
My guest today is Alison Tierney. She is a cancer dietitian, and she's here to share what she is doing to help her patients, both those who are being treated for cancer and those who have moved into survivorship. She's going to tell us what we can all do in order to set ourselves up for the best chances for success if we have cancer, being treated for cancer, or if we would like to hopefully avoid having cancer, or at least drastically reduce our risk. What things can we control in terms of nutrition? She's going to share that with us. And there is a soft close on this one because she dropped a bomb. She surprised me in our interview. So about two-thirds of the way through it, you'll see that I kind of wrap up the conversation and then she tells me more. And so keep listening because she's going to share her own personal story in the last third of our conversation. And there's going to be some great takeaways from that as well when it comes to the things that we can and should do for the sake of our own health and being treated for illnesses. So here's my interview with Alison Tierney.
Yes. So I'm an oncology dietitian, and
Okay.
I help patients during the course of treatment to better tolerate their treatments and stay adequately nourished. And then outside of treatment into survivorship, working with them to optimize their nutrition to reduce the risk of recurrence.
All right. Nice.
Mhm.
How did you get into it?
Yeah, so I actually always wanted to be a dietitian, but ended up going to school for business. But I was a college athlete. So nutrition really sparked for me in the sports performance area. I wanted to know, like, how could I improve my nutrition? Or, excuse me, I wanted to know how I could improve my sports performance with nutrition and other natural processes. So I ended up getting to that. But then when I was in college and playing softball, my mom was diagnosed with breast cancer. My grandfather was diagnosed with liver cancer. My grandmother had been diagnosed with breast cancer. My godmother, who's my mom's cousin, had been diagnosed with breast cancer. And then my mom's mom passed away from lung cancer before I was born. So super extensive history of cancer in my family. And my thought about nutrition really started to shift and wonder, how could nutrition play a role in supporting during the course of treatment? Can it help reduce the risk of developing cancer in the first place? Can it help in survivorship? And that's really started to turn for me. And I ended up graduating from college with that business degree and thought that, it was over. There's no going back to school to be a dietitian. And I was 21, right? Is actually my husband who was the biggest supporter of me going back to school to be a dietitian. And I knew I wanted to be an oncology dietitian. So I told all of my professors, anybody that I could, that I wanted to be an oncology dietitian and that I wanted every opportunity available to learn oncology nutrition. Because when you go to dietetic school, we had one 1-hour lecture on cancer nutrition in the whole 4-year program.
Wow.
So I knew that I needed to seek other ways to educate myself on oncology nutrition. So I shadowed any dietitian that would take me, ended up getting an internship at a well-known national cancer center as a dietitian there. They hired me on full-time afterwards. And that's where my career started as an outpatient oncology dietitian. And I had landed really this dream job, except for the only problem was it was not near my hometown. And I knew I kind of wanted to move back home. And there was a cancer center that was looking for an oncology dietitian to grow, run, and manage a nutrition program. They didn't have one yet.
Okay.
So I applied for the position, and it happened to be the same place that my mom was treated for breast cancer. And I got the role and was able to really work in depth in this brand new oncology program and make it what I wanted it to be, and support patients throughout the course of treatment to help make sure that they can tolerate treatment, reduce side effects, improve their quality of life. And also, we know that with adequate nutrition during the course of treatment, we have improved efficacy or the working of chemotherapy as well. So there's so many great advantages of employing a dietitian and nutrition interventions during the course of treatment. So that's kind of where it started. And then as I continued into that career, I started my own side hustle, I guess you could say, of Wholesome LLC. And it was really, my husband was working a lot of hours and I just kind of did it for fun. That's where it started. But I wasn't able to work with patients that were outside of the cancer center that I worked at. And so people started coming to me from outside the cancer center that I worked at wanting to work with me. And it became an opportunity to be able to do that. And it kind of just got to a point where I knew I needed to decide, okay, I'm going to do this wholesome thing exclusively, or I'm going to stick with the traditional cancer center and model. And I decided to take the leap and go into my own private practice. And I'm so glad that I did that. I did that officially at the end of 2018 and have been working exclusively in Wholesome in my private practice.
Wow, congrats. That is
Yeah,
awesome.
thanks. Yeah,
That
thank
is
you.
awesome, man. And I can see, I mean, from your own, family history, and I mean, and just being in the health space myself, like helping people to be as successful as possible in treating cancer
Yeah,
is huge. Like it's
absolutely.
needed. Wow.
Yeah. Yeah. I think one of the best compliments that I've received is that, because I believe that nutrition goes so much deeper than actual nourishment, right? It goes deeper than that. And the best way that this particular client described to me is said, you gave me empowerment at a time that I needed it most. Because when you're diagnosed with cancer, there's so much that's out of your control, right? And nutrition, lifestyle, mindset, those are pieces that you can grab control of and help positively influence a really unfortunate negative situation, to really better the outcome and live the best life possible.
Nice. So, I will drop a little bomb on you here, which I
Yeah.
wasn't necessarily, I mean, when we scheduled the interview, it was, like we said, I've been following you on social media for a while.
Yeah.
But my mom has pancreatic cancer. I'm
Okay.
not, I know I do this podcast every week. I've never
Yeah.
actually mentioned that.
Yeah.
Just because we try to keep it positive and everybody else
Yep.
is, but as we're talking about, I feel like I should let you know that because I have been like reading about cancer nutrition. I've been going with her
Yeah.
to her appointments.
Yeah.
So I I think we'll probably be able to have a pretty awesome conversation now
Yeah.
around it. So
Absolutely.
I want to ask you this, and then I'm taking notes here. I have other questions
Yeah.
too now. I feel like oncology and nutrition aren't necessarily, um they don't work together often. And you that's exclusively what you do. So I'm curious to know,
Mhm.
do you see that, or is it just the doctors I've been talking with?
Unfortunately, I see that all too often. And I think there's multiple reasons for it, why nutrition isn't intertwined in the traditional model of cancer treatment. And I think part of it goes to what a lot of people don't know is that physicians in medical school, there is zero requirement to have any nutrition courses in medical
Mhm.
school. Um, it's been shown that only 25% of medical schools have one class in nutrition. Okay. So
Okay.
our physicians aren't trained in it. Right. And also, they don't really have time to talk about it. Right. There's so much other things that they should be focused on. And, the way that I see it is I want my oncologist to be the one who knows the treatments and the cancer in and out and knows, the top of the line treatments, the top of the line clinical trials. And they don't have time to dive into nutrition research when they're doing all those things and managing the day-to-day patient care. But really, when it comes down to research, we have a bounty amount of research to show that nutrition can really positively impact patients' lives in a positive but also a negative way if we're using the wrong nutrition approach during the course of treatment and into survivorship. So, I mean, other reasons, unfortunately, I really think has a lot to do with reimbursement in the medical system. There's no reimbursement for oncology nutrition visits. Therefore, it's not a profit generating type of service or appointment. Therefore, it's not commonly employed by the hospital systems. And that's actually why you see a lot of dietitians that are in private practice. We don't take insurance commonly because there's very little to no reimbursement. And of course, we can't thrive in a private practice accepting no reimbursement, right? It's just as much as we'd love to be able to have that kind of model, it just doesn't exist, right? And so there's lots of unfortunate reasons for it. I do think it's starting to get better. And I think it's starting to get better because the patient population and the caregivers of the patients are asking for it. And that's what matters most, right? Is that where's my access to a dietitian, right? And they just don't have it. And you and I both live in the state of Wisconsin, right? I'm board certified in oncology nutrition, which is a special board certification on top of being a dietitian. And you have to have 2,000 hours of practice in oncology, sit for a board exam every 5 years. You have to repass the exam, right? So there's some really strict guidelines to become certified. In the state of Wisconsin, the last time I looked, there was 7 of us oncology dietitians. There's not enough to go around. There's not enough to go around. And there's a lot of other pieces of that too. So to answer your question, it doesn't go hand in hand often, but you're seeing because it's just not focused on. But research has proven over and over again, we can reduce hospitalization rates, which then therefore improves so much costs for medical costs and just help patients live better. There's so much more to it. And I hope to be able to, I can't certainly do it alone, but continue to advance this part of oncology care and nutrition, that it gets incorporated into anybody's treatment plan.
Gotcha. Wow. So, so a question that just popped up for me, as you're working with somebody, is it more about using nutrition to help kind of optimize them regardless of the cancer, and so that they're in a better situation, but they're in better shape to deal with the disease? Or is there research and techniques available to actually use nutrition to treat the disease, to keep it from spreading, for example?
Yeah, it's a little bit of both. So research has come a long way, but it still needs to continue to advance to learn more. But for example, we have these nutrients that are called phytonutrients or phytochemicals, right? And these are plant-based nutrients found only in plants that have been shown to have really incredible benefits. And one of them includes helping to prevent DNA damage, which is kind of a hallmark of cancer development, but also help repair DNA that has already been damaged, right? So when we have these cancer cells, it can help take care of those cells, right? But what we know when it comes to nutrition and cancer is that it's a long-term game, not necessarily a short-term game, right? So there's definitely differences of opinion when it comes to this. We've heard of, radical remissions of individuals that maybe opt not to have chemo and radiation, and they cured their cancer by doing this, right? Or doing that. What we know from the evidence is that when we pair nutrition with it and other modalities too, not just nutrition, but exercise, mindfulness, spirituality, all these different things that make whole person health, that's when we have the best opportunity to be able to fight against cancer. But the other piece of it that you already mentioned is that when we're able to use nutrition to optimize an individual's nutrition status, we're able to help them preserve their lean body mass as much as possible. We know that they're able to tolerate treatments better. We see reduced doses of chemotherapies. We want to try to actually receive our full dose of chemotherapy in order to optimize. Okay, this is the research shows that this particular type of cancer responds to this dose of treatment, right? If we have severe side effects, they might do a dose reduction, and that's not optimal. Or they might skip cycles of chemotherapy because the patient just can't tolerate it. And research shows over and over again that nutrition interventions can actually help reduce those things from happening.
Gotcha. Wow. Okay. So I guess Man, I could talk to you all day now. Um, could we do this? I would like to just hit, and maybe it'll be similar, but
Mhm.
talk about maybe some of the specific foods that help with, for the
Sure.
most part, help with treating, but also preventing.
Mhm.
And maybe
Yeah.
as two separate questions. So,
Mhm.
particular for someone who's listening that may have cancer,
Yeah.
what should they be looking for,
Mhm.
just in general? And then how about the rest of us without a diagnosis?
Mhm.
What can we do to avoid having one, hopefully?
Yeah. Yeah, absolutely. So I really think that, let me start over here. So, what is actually important in terms of the foods that are going to help somebody during the course of treatment that already has a diagnosis actually are very similar to the people that are going to want to try to reduce the risk of developing cancer in the first place.
Okay.
What really differs for that patient that is going through treatment is potential side effects that they might be experiencing. I'll give you an example. One of the greatest cancer fighting foods that we know about is cruciferous vegetables. So, cruciferous vegetables are broccoli, kale, cauliflower, cabbage, Brussels sprouts, etc. They contain these phytonutrients that are called sulforaphane or glucosinolates. These are some of the best cancer fighting phytonutrients that we've been able to find. So, somebody that has cancer or somebody that's trying to reduce the risk of developing cancer, it would be highly encouraged for them to incorporate these types of vegetables into their daily diet as much as possible. However, if someone's going through the course of treatment and one of their side effects is loose stools or diarrhea related to that chemotherapy, I'm going to recommend that they don't consume that food for that isolated period of time so that we can get their bowels back to normal and allow them to eat again, right? And sometimes the question for patients is like, but this is a really cancer fighting food. I want to include this. Why are you stopping me from including it right now? Well, because during the course of treatment, if we have really loose stools or diarrhea, then we're risking electrolyte imbalances, weight loss, rapid dehydration, hospitalization, right? And those things long term can lead to unideal situations when it comes to completing treatment.
Yeah.
So that's how it really differs. So when I'm working with a patient that is going through the current course of treatment, the foundation of what we talk about and try to implement really is a cancer fighting diet that would be the same for someone who's trying to prevent it in the first place. And as they go through treatment, we adjust the diet according to their side effects. Another example would be somebody who is experiencing mouth sores during the course of treatment would have a really difficult time tolerating anything that's acidic, right? Or maybe they have a really difficult time chewing or swallowing, depending on, if they're experiencing radiation to the head or neck. We're going to adjust those foods so that they can stay as nourished as possible. Does that make
Gotcha.
sense?
Yeah. Awesome.
Yeah.
So broccoli.
Broccoli, cruciferous vegetables. Broccoli sprouts actually are even more incredible. So broccoli sprouts are essentially the start of that plant. It's immature broccoli, and it actually has some of the most concentrated amounts of sulforaphane, or that cancer-fighting phytonutrient that we talked about. So if you can
Okay.
get your hands on some broccoli sprouts, that would be incredible. That doesn't mean regular broccoli or broccolini is not great, because it still is, but broccoli sprouts are pretty incredible.
Awesome. We love
Mhm.
broccoli at our house, so
Awesome.
that's great news.
Yes,
Man.
exactly. I love
Cool.
that. So,
Oh, go ahead.
no, I was just going to say some of the other foods that we really focus on when it comes to cancer fighting foods. And when we look at the data available between the World Health Organization, the American Institute for Cancer Research, the American Cancer Society, the World Health Organization, over and over again, the biggest overarching theme is a plant predominant diet. Now, some people might hear the word plant-based or plant predominant and think, does that mean that I need to be completely vegetarian or vegan? That's not what it means, right? Some people will opt to have a completely plant-based diet. And in fact, there's research to show that it's very supportive to help reduce the risk of cancer. However, someone can absolutely include animal-based proteins and products into their diet and still be highly plant-based. So I really encourage people that really think about being plant predominant. If they want to be exclusively plant-based, go for it. That we can absolutely have a nourishing, adequate diet, completely plant-based if someone chooses to. But when we're looking at this, when we're looking at a plant-based diet, we want to try to incorporate as much fruit, vegetable, whole grain, legumes, and some nuts and seeds as much as possible. these are the foundation of a cancer fighting diet, and for multiple reasons. One being that these foods all contain the phytonutrients that I keep saying over and over again, right? I usually tell my clients, like, you might get sick of me talking about phytonutrients, but that is where so much of these benefits are. The other component of it is they're highly fibrous. Fiber is so important, not only to just have a healthy bowel movement, which most people think about, but to really optimize our gut microbiome, which is that environment that lives within us and the good bacteria, maybe bad bacteria, that actually supports our health. So if we have a gut microbiome that's optimized and we're feeding it fiber, which is actually the fuel source for these good bacteria in our body, it actually reduces inflammation. Okay. And inflammation can be the root cause of many different types of disease, but especially in the case of cancer, because inflammation can lead to DNA damage, which leads to essentially when DNA is damaged, which is the building block of essentially of who we are. If you have one cells that DNA is damaged, it's going to replicate and divide. That's how cancer starts, right? And cancer continues if those cells are not taken care of, right? So we want to try to reduce inflammation and make sure that we're reducing our risk as much as possible. So that's really why fruits, vegetables, whole grains, and legumes have such great impact when it comes to reducing cancer risk, but not only cancer risk, heart disease risk, diabetes risk, high cholesterol, autoimmune diseases, the list goes on. And that's partly what I love about a plant-based diet, is that it's not just, oh, it only supports this and hurts maybe these other areas. It's supportive of whole person health in the long term.
Okay. Well, awesome.
Mm-hmm.
I am like, as I'm listening, I'm like, it doesn't look like you have any notes. You're just like, man,
I
you know
don't.
this
Yeah, I
stuff.
don't have any
I
notes.
love it. And I can tell how passionate you are about it.
Yeah.
What is the best way for someone listening to connect with you, to benefit from the resources you have available and from the work that you do?
Yeah, absolutely. So the best way to reach out to me is through my website, which is wholesomellc.com.
Okay.
And actually, what's pretty fun, well, I'm biased, but I think it's fun. I have a What's Your New Cancer Nutrition IQ quiz, and where you can go and take the quiz that I throw out some of the questions about cancer nutrition, right? And the foundations here. And it gives you a ranking of where you are in terms of your cancer nutrition. And then based on your quiz results, I direct you to some more resources that can help build that foundation and that knowledge, because I'm a really big believer in being able to help people understand the knowledge. And what I mean by that is, of course, Nate, you probably knew coming into this that broccoli was good for you, right? But did you know that it had sulforaphane and glucosinolates that is some of the best cancer fighting properties, right? Maybe not. And maybe some of the listeners didn't either. But when I can share that with you and I can give you that more deeper knowledge and understanding, you're going to be much more motivated to start including more of those things into your diet. So I really like that foundation of helping teach people the why, and then taking it the next steps, the how, and how to implement it into a regular everyday life.
Gotcha. Wow.
Mm-hmm.
Awesome.
Yeah.
We'll have a link to your website, and then can we put your Instagram on there too in the show notes?
Absolutely. Absolutely. Yeah.
Okay.
Mm-hmm.
Awesome.
Yeah. Yeah.
Allison,
Yeah.
thanks so much for being here. This was
You're
awesome.
welcome. Did you want to talk at all about me being a cancer patient? Did you know that?
No.
Okay. I am a cancer survivor.
You have time to talk about this?
I do have time. I have like
Oh,
15 minutes. Yeah.
all right.
So
Yeah, let's do it.
I just finished my cancer treatment 3 weeks ago.
Seriously?
Mm-hmm. Yeah.
Oh my
So
goodness. Okay.
yeah.
Wow.
Yeah. You just want to tell me, you want me to tell you what
So
happened?
so all of the work that you did to become a dietitian and an expert with oncology, this is all
Mm-hmm.
was that prior to your diagnosis?
Mm-hmm. Yep.
Oh my
Yeah.
goodness. Okay.
Yeah. Yeah. So, kind of for me, what happened is I went into an annual exam with my OBGYN, and it was only 10 days after I finished breastfeeding my second child. And she found a lump,
Hmm.
and we didn't really do anything about it at first because I just finished breastfeeding, and breasts change so drastically during pregnancy and nursing, et cetera. But I went home and I kept feeling it, paying attention to it. And every time I felt it, I felt really anxious. That's kind of like the only way that I've been able to describe it to people. And it was actually while I was preparing for a presentation, I was going to be the main speaker on breast cancer nutrition at a conference. And I came across some research that shows, breast cancer after pregnancy and nursing, not how rare it is, but that it's possible. And I came across that reminder and I thought to myself, I need some peace of mind about this, because I had had a lump between my pregnancies that we had ultrasounded and went away. This one wasn't going away. It wasn't changing. And I have an extensive family history, especially of breast cancer. And my OBGYN was also my mom's physician who diagnosed her with breast cancer.
Okay.
And so quickly I said, I want to get this checked out. And because of my history, my doctor was fantastic. She's like, let's get an ultrasound right away. We'll take a look at it. And I got an ultrasound and turned into a mammogram, which turned into a biopsy, which turned into a positive diagnosis just 2 days later. And so originally I was diagnosed with something called DCIS, which really means that the cancer has been contained to the milk duct. Some refer to that as stage 0 breast cancer, so like the very beginnings of it. So after that, I met with the surgeon, and because of where the tumor was located, they were automatically recommending at least a single mastectomy on that cancerous side. And I had opted in my own mind that I was going to do a double mastectomy. I thought to myself, I was 33 at this time, not to mention very young, right?
Yeah.
And only, I think it's 2 to 5% of breast cancers happen under the age of 35. I think it's 2%. So I get to be a part of this very small select group, right? And anytime we have a cancer diagnosis this young, you automatically get genetic testing. Mine came back positive. I did actually not expect it to come back positive because only about 5 to 10% of all cancer cases are related to genetics. And I knew this stat. I knew that most cancers, that's a common question. Like, do you have a family history of it? And people, no, but it's a very low percentage of people that are actually have this genetic mutation. And so I had that now because of the genetic mutation, they were recommending a double mastectomy, which I had already decided to do. So in July of 22, I had a double mastectomy with something called D-flap reconstruction. So D-flap reconstruction is when you are able to use your own tissue to recreate the breast rather than using an implant. The reason I specifically chose that route is I have a twin sister who has lupus, and so an autoimmune disease. So I knew that I was already at a higher risk for rejection. And so I had the surgery. And every time they do surgery like that, they're going to still do a surgical pathology on the tumor. And my diagnosis came back different. It came back as invasive ductal carcinoma, which means that it had spread from the milk duct and beyond that. And then breast cancer is there's so many different avenues that you can go down, right? So the next part of breast cancer is determining what fuels that cancer, right? So there's 3 markers for breast cancer. It's going to be estrogen, progesterone, and something called HER2, which is a type of protein. And so they look at these different markers and what is fueling that breast cancer. And long story short, I turned out to be triple positive, meaning that I had all 3 of these markers that was fueling cancer. And that means an automatic qualification for chemotherapy. So I went from only really needing to have surgery to having to undergo 3 months of chemotherapy and a full year of immunotherapy. So last August through November, I did weekly chemotherapy for 12 weeks. And then after chemotherapy, I switched over to immunotherapy, which takes place over the course of a year. And at the time of this recording, I finished treatment 3 weeks ago. And my next step is I have 1 more surgery left, and then I'll be considered like active treatment finished. So as you can imagine, it's been quite a whirlwind and unexpected at the age of 33. And I also say quite an ironic twist to my career, right, as an oncology dietitian. And I think prior to my own diagnosis, I never thought I was invincible of developing cancer. Nobody is completely invincible from developing cancer, right? As you can tell from what I like to talk about, I powerfully believe in controlling the controllables and taking action on the things that you can control to reduce your risk. But I wanted to be able to say, and I said this multiple times to people before I was ever diagnosed with cancer, is if I am ever diagnosed someday, I want to be able to look back and say, I did what I could.
Mm-hmm.
And I believe that I can say that. Now, that's not to say I was doing everything perfectly. I'm a mom of 2 girls. I run a business, I run a household, right? Like I was not doing everything perfectly. And but what I really powerfully believe is that my diet and lifestyle going into chemo, going into immunotherapy and surgery was really what allowed me to thrive throughout all of that. I had multiple people at the Cancer Center tell me that I handled chemo better than anyone they've ever met before. I employed a lot of strategies, nutrition wise, that I teach my own clients. And it's not to say that I didn't have hard days and I didn't have side effects, but I was really able to thrive throughout it. Right. I was still exercising really regularly. But I also, in this DFLAP surgery, I walked to my follow-up surgery appointment just 2 weeks after surgery. And I have a huge abdominal scar from hip to hip. So it's a huge abdominal surgery, right? And my surgeon was like, you what? You walked here? So, and it's one of those things is like, I powerfully believe in the empowerment of movement and exercise. And like I mentioned before, it goes far beyond for me, just the nourishment, but what it does for you mentally, emotionally, et cetera.
Yeah. Wow. Thank you for sharing that. I can't,
Yeah, absolutely.
I cannot imagine how that has impacted, first of all, you personally and your family, but
Mhm.
the way that you continue to support your clients.
Yeah. It's taken, of course, my work to a whole new level. I would never have wanted to go through this experience, but what I'll take away from it is that I can relate to my clients on a whole new level that I
Yeah.
wasn't able to before. I've been there. I call it that chair. I call that chair for chemotherapy, right? Nobody ever wants to sit in that chair. I've sat in that chair, right? And although our journeys are different, I don't believe there's one cancer journey that is the exact same as someone else. When when you can talk with other survivors and other people that are going through it, it makes a world of a difference because they get it, right? As much as my husband wants to understand what I've gone through, what I went through, he can't fully understand it. But totally the same for him. I don't understand what he's experienced in the last year watching his wife go through this, right? And taking on all the extra responsibilities as I went through treatment. But I think when we're able to come together and understand that we don't know what it's like to walk in somebody else's shoes, but really be empathetic, like that can really transform how we experience life in general.
Yeah. Wow.
Yeah. Yeah.
Will you come
So
back
of
again on the podcast?
course. Yeah, I'd be happy
Man,
to.
this was
Yeah.
awesome. I
Yeah.
have so many more questions for you,
Yeah.
but we'll stop there for today. And let me
Sure.
just say thank you. I'm really grateful for you sharing your story, your knowledge,
Yeah.
and for the work that you're doing. And I know that I'm not
Yeah.
alone.
Oh, thank you. And thanks for having me and allowing me to share my story. Because, I do think that sharing my story, if it can help just one other person, like how beneficial that is. And even the people that have reached out to me that said, I got my mammogram or I got my colonoscopy, or I was really concerned about this, but nobody really listened that I was concerned and I brought it up again, like how important that is to trust our intuition, that something doesn't sound right, to get it checked out and ask more questions, because we do have to be our own health advocates and we have to be able to do that moving forward for our own health and the people around us.
Yeah,
Mhm.
absolutely. Thank
Yeah,
you. Thanks
you're
so much,
welcome.
Allison.
You're welcome.
Such a great interview. I want to thank Allison again for being here on the show. And I have links in the show notes waiting for you to get in touch with her. Also, other resources are there for you. Now, without belaboring this, because I know that was a little bit longer interview, but I wanted to share the whole thing with you because I found it to be absolutely fascinating and so beneficial. After listening to it, I would invite you just to slow down for just a moment. Think about all that you heard and ask yourself what might be. the next step for me in order to move forward into taking better care of myself. I know we've discussed that many times. That's one of my favorite questions to ask, but I think after such a powerful conversation, that one really needs to be put out there for each of us. Before I let you go, I want to express a little gratitude. I want to express gratitude to you for being here. Those that have reviewed the show, rated and reviewed the show on your podcast player, I thank you very much for doing that. If you haven't done it already, I invite you please to do so, because it helps this podcast to stay in the top 10% of all podcasts, and will help others to find the show and to benefit from it the way that we are. My hope is that it helps you to stay motivated in taking good care of yourself. It helps you to constantly focus on what you might be doing a little bit better in order to keep moving toward being a healthier version of yourself. Thank you again for being here, for sharing your time and attention with me. I will talk with you again soon.